Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are
Propelled by Plants. Today we bring to you episode 375, Understanding Chronic Kidney Disease with Dr. Robert Breakey.
In this episode of the Plant Trainers Podcast, we talk with Dr. Bob Breakey about kidney disease. While kidney disease is not talked about that frequently, it does affect 1 out of 7 North Americans, and it can seriously alter one's quality of life as well as their longevity. We cover everything from what the kidneys do to how to find out if you're having kidney issues and what the prescription is, nutritionally speaking. If you find that you're confused about which foods may worsen kidney stones or chronic kidney disease, you'll be extremely clear by the end of this episode. We highly suggest that you share this with anybody who has moderate or severe kidney issues or kidney issues running in their family. Kidney issues does become an issue with people who are obese as well, so please kindly share this out with anybody who you think may be affected.
Dr. Breakey is a 5th-generation graduate from the University of Michigan Medical School. He completed his family medicine residency at the University of Wisconsin in 1984 and his board certification with the American College of Lifestyle Medicine in October of 2019. He's practiced lifestyle family medicine in Ann Arbor for 35 years. Amongst other things, he's also the medical director for the IHA Lifestyle Medicine Institute and the chairman of the board for the Plant-Based Nutrition Support Group, as well as a board member for the National Organization Plant-Based Prevention of Disease, or PPOD. In his spare time, he enjoys skiing, rollerblading, whitewater rafting, scuba diving, hiking, and travel. To help support him in maintaining the vitality to do all of this in his mid-60s, he's followed a plant-based lifestyle for the last 43 years.
You have a huge collection of recipes, but you never make them. And you never even know what is for dinner. Things seem to kind of get out of control. You do your shopping, you hope that you're getting everything that you need, and then when 4 or 5 o'clock or 6 o'clock comes around, you're still scrambling to figure out what's for dinner. That used to be our life, and then I figured out the perfect system to make sure that everything was in order. I always had all the groceries that I needed, and that I was making nutritious food for my family without the headaches of the scrambles. So we created the Meal Planning Mastery so that I share all the tools that I use here in the Chaim Plant Trainers Kitchen so that you have them to be able to create your own meal plans with your own preferences so that you are organized and life is just that much more simple. So you can find it on our website at planttrainers.com/shop or click the link in the show notes at planttrainers.com.
And now for a moment of gratitude.
The kids went back to school a few weeks ago, and on that first day, I walked them to school and said goodbye and came home to a house that was quiet, that I worked in whatever room I wanted to. And although I am a little bit excited that they were off to school, I'm really excited and grateful to be able to say hello to them and greet them at the end of the day. I really did miss that over the last 6 months.
I've been back to school also, and it's been a very different experience, but I'm grateful for the fact that everybody is taking some precautions and taking care of themselves. And while getting back to school is going to be challenging, it's also important that we're all taking care of ourselves, and I'm grateful for people actually taking those steps in the right direction.
Dr. Breakey, thank you so much for joining us on the Plant Trainers Podcast today.
Thank you. It's a pleasure to be here. I appreciate the opportunity.
You're welcome. And you're sitting outside in your beautiful yard, and we might hear some birds chirping, and I just love that outdoor feel. So thank you for bringing that to us. I'm grateful for that. Is there something that you're grateful for today?
Oh, my gosh. Well, of course, days like this when I can work outside, but also this time of year in Michigan, a particularly awesome form of cantaloupe comes into season. I don't know if those who are on video can see it, but these Crenshaw melons come into season at the farmer's market. And, oh, my gosh, it's like candy.
Snack break.
So thankful for the ability to enjoy healthy plant-based foods that are also super tasty. So it's great to have awesome foods, farmers markets, and this time of year in Michigan, and I'm sure across many of the areas where your listeners are, these foods that bring great pleasure to us are in season. It's awesome.
Summertime is definitely an abundance of plant foods, and to know that you can get them a little bit more local than you might be able to during the winter for us northern hemisphere people, it's beautiful, and that's definitely something to be grateful for. Were you always plant-based and grateful for all of this abundance of fruit and vegetable, or is this something that came later on in life for you?
Wow, no, when we were kids, we ate horribly. My mom and dad didn't know better. They taught us the standard American diet back in the 60s. And, oh, wow, we had Captain Crunch with whole milk. We had ham and cheese sandwiches and some kind of meat and dairy every day. I developed a severe form of hand eczema, was treated with stronger and stronger steroids. My brother had his tonsils out. Another one had recurrent constipation. It was sad because later at age 21, when I was in medical school, I did some more research and started learning about the social, the environmental, and the health effects of the kind of diet we were on. Switched at that point in 1977 to a plant-based lifestyle, and my eczema resolved. I never had felt terrible, but I felt great. And now at age 65, 43 years later, I love rollerblading and flyboarding. I love to ski fast and go scuba diving. All the things that life has to offer are still available for me because I have my health. And I attribute a good part of that to my plant-based lifestyle for all these years.
You're probably one of the longest plant-based people we've had on the podcast. I mean, we hear people like 21 years and we're like, wow, we wish we had that. But yeah, 43 years, that's incredible.
So how come you found this through your own research in medical school at the age of 21, 43 years ago? Why is it taking so long for the rest of the world to find this lifestyle and see all the benefits that you're noticing?
Well, there are several reasons for that. One, of course, is just societal norms. It's sort of normalized from an early age for people to eat the way that we're taught, and that's passed on through the generations. So it seems different or odd, even though looking around the world and through human history, really the normal is a plant-based diet. But we've been socialized against that. And then, of course, you have powerful forces, industries from food to agribusiness to pharmacy to others, who really don't want it to change. And they have gone on a campaign to promote their products. It's not that they're evil, they're just doing good business. And it comes out as a misinformation campaign using their lobbyists, their influence to sponsor studies that are not well done, to confuse people. And so in general, people are fairly confused about that, even though among unbiased experts, there's no real controversy. It's overwhelming evidence that a whole food plant-based diet helps people to optimize their health and prevent chronic disease. The general public is confused by these so-called experts who put forth an opposite view or the latest fad. The media doesn't help either, because it would be boring if every time they came on they just said, yeah, keep eating plant-based. Well, that doesn't sell a lot of Time magazines or Good Morning Americas. What sells is, oh, newsflash, butter is back, or, oh, we had it wrong, cholesterol doesn't matter anymore. And, everybody's attracted to controversy, Dr. McDougall says people love to read that what they love to eat is good for them.
Controversy is sexy, yeah.
Yeah. And we have cravings for those. We have built-in cravings for fat, salt, and sugar, so people want to hear that's it. Then you have our education system, everything from educating the population to our medical education that is centered around the status quo. So, yeah, I had hoped, as I've dedicated much of my career to helping educate people on this, that we'd be further along now. But that said, I have never seen it like this. In these last 5 years, really, I think these last 10 years since Forks Over Knives came out, the interest, the growth, the number of people talking about it, the great podcasts like yours that are truly educating people about the truth have come out in waves. And now this whole viral pandemic is focusing greater attention too on, well, where did that come from and what can we do to maintain health, enhance immunity, prevent the next pandemic? Well, it's all pointing towards whole food, plant-based lifestyle as the best way to solve all of that. So even though, again, the first 35 years was pretty paddling upstream, I find now that the interest, the momentum for this is growing at such a rate that I'm very optimistic these next 10 years will bring a sea change.
This is amazing, and we have so many people coming on our live videos saying, I've been, plant-based or trying to be as plant-based as possible for the last 3 weeks, 4 weeks. It's more and more and more people who are getting the message, and thank you for the work that you're doing. And I wanted the listeners who have been listening a while, or even a short while, when we interviewed Dr. Melissa Sunderman, she was telling us about her new position at the hospital or the clinic in Michigan. And she said, and I'm almost quoting, and when I was in the interview, the doctor leaned over the table and said, so what are your views on if you can reverse diabetes? And I was like, wow, somebody other than Esselstyn asked you that question. And so you are the doctor that asked Dr. Sunderman that question. So I just wanted to make that connection there. And we'll link back to that episode in the show notes at planttrainers.com for sure. And just recently, you were actually at the PPOD conference talking about kidney disease.
Yes.
And is that a conference that you've participated in before?
Yes, absolutely. I'm on the board for PPOD, and I've been participating for these last 4 years. It's a conference where we bring together national and international experts on plant-based prevention of disease to talk about the prevention and reversal or treatment of chronic disease. Of course, commonly the heart disease, cancers, hypertension, obesity are ones that commonly come up, but not so much about the kidneys. So we decided this year to include a segment where I did the keynote talk, and we had 4 panelists, including 2 nephrologists, Food for Life instructor, and a renal dietitian join me in our presentation. And again, very well received. I think people don't realize both the extent of chronic kidney disease and the importance of lifestyle and maintaining healthy kidneys throughout your life.
It is quite important. And I think when people think of kidney, they think of kidney stones. Mm-hmm. And, they think of dialysis or even maybe diabetes. So can you give the listeners a roundabout idea of what those chronic illnesses are and how they can really affect the body?
Yes. Let's back up a little step and talk about the kidneys. These are 2 organs here in the middle of our back. The main job is to filter the blood, and they also maintain pH and electrolyte balance. They activate vitamin D and form other hormones that help in red cell production and long-term blood pressure control. They work 24/7, filtering 150 quarts a day to produce the 1 or 2 quarts of urine that we put out that remove toxins from our body and do all those balancing. If they're not working well, nobody else is doing well either, and so critically important. At the microstructure, there are about 800,000 nephrons, microscopic nephrons in each of our kidneys that perform these heroic tasks all the time. And these, again, are critically important to the function of everything throughout the body. So chronic kidney disease then has become epidemic, affecting 1 in 7 Americans now, and 1 in 3 over age 65. So the incidence increases with age. It's estimated now that because of the growth rate, that half of all Americans now aged 35 to 64 will get chronic kidney disease at some point in their lifetime. I mean, again, talk about epidemic. You're talking about half of people. So we're facing a great challenge with this, and as you suggest, we want to get to the root cause of that and try to figure out how we can mitigate those harmful effects. Tell me again a little your question, because I think No,
that's fine. That's a great explanation. So about 10 years ago, I was told that I have a tumor on my kidney, and I was told that I needed it to be removed immediately. And for people that are in that kind of a situation, I was told that you could live with one kidney. Is that correct?
Yes. Yes, we have an excess, we have a reserve of kidney function, and you certainly can survive. And sometimes people donate a kidney as part of a kidney transplant and do fine. So, and that's why, it takes over time, because even though the kidneys start to go down in function, that reserve serves us well, and it's not often until later that it starts to get to a point that it can cause great challenge. I remember a little more about your question, though. You alluded to diabetes and hypertension. These are the two most common kind of risk factors for chronic kidney disease. Diabetes accounting for about 44%, and high blood pressure about another 25%. So almost 3/4 from those two risk factors. Not everybody with those gets chronic kidney disease, of course, but those put an extra strain on the kidneys. And we'll come back to this, but that's twofold. It's both a common root cause, the same thing that puts a strain on the blood vessels causing hypertension, or the insulin resistance causing diabetes also is toxic to the kidneys, but also those diseases create an environment where it's hard for the kidneys to do their function. There's a group of other miscellaneous causes, and one of them, as you mentioned, is urologic causes or kidney stones. If there's a urinary tract blockage, kidney gets blocked or backed up, then that can cause acute kidney injury, and if not solved, lead to chronic kidney disease as well. And kidney stones are also largely preventable through nutrition and lifestyle. We can cover that if you want to also.
I want to get into how to attack or reverse or prevent some of these diseases, but what are some of the other big ones that are affecting people's quality of life or even lifespan?
Oh, wow. The chronic diseases I see every day in my office, we talked about the two big ones, hypertension and diabetes, hyperlipidemia or elevated cholesterol, which of course leads to our number one killer, coronary artery disease, and then strokes. In older folks, we see Alzheimer's, which actually starts much earlier in life, can start 20 to 30 years earlier, and that's becoming epidemic now as a result of our lifestyle. We see cancers, especially colon, prostate, and breast cancers at huge rates. The second leading cause of death in the United States is cancers, which are also preventable with lifestyle metrics.
And in terms of the kidney diseases, which are the bigger ones that people are seeing? Which are the most frequent?
Yeah, the chronic kidney disease is the most frequent, affecting, again, at 1 in 7. But kidney stones are also an increasing incidence. Used to affect 1 in 20, and now 1 in 11, just in 20 years. So the high protein, animal protein in particular, is the main risk for kidney stones. There's also polycystic kidney disease. There are other forms that can cause kidney failure. But yeah, definitely CKD and stones are the two biggest.
And what are the stones? Are they actually calcification that are making little stone-type things within the kidneys?
Yeah, that's right. They're literally stones. They're made, the vast majority of them are calcium oxalate stones. They may have a uric acid nidus or a core, and then around that, just like that crystal experiment you did in 4th grade with the saturated sugar solution, they crystallize out with calcium and oxalate around that, and they can form stones as small as microscopic and as large as half an inch. And or even larger. You get what's called a staghorn calculus that fills most of the pelvis of the kidney. And these stones then can block the ureter, the drainage from the kidney, and cause severe pain. Some of the patients in the most pain I've seen have been in the middle of a kidney stone episode. So yes, these stones are also quite common. My dad was a urologist, so I remember around the dinner table as kids, or he'd take us on rounds in the hospital, seeing people with the effects of kidney stone disease. And again, unfortunately common, but fortunately also largely preventable.
So you mentioned one of the reasons that people get the stones is because of excess animal protein. There's also talk about it being due to overconsumption of calcium through the oxalates in the spinach or the almonds or things like that. But then there's also talk about dehydration being a cause of that. Is that truth, or is there other reasons?
There are kernels in each of those. Dehydration can be, obviously, the more concentrated the solution, the more likely it is to crystallize out. So eating plenty of water foods, fruits and vegetables, hydrated beans and grains, and drinking enough water are important parts of that also. And it's not so much a calcium excess, though. We used to think, hey, calcium is the main component, so don't eat too much calcium. And certainly dairy is a double whammy because the animal protein and the excess calcium. But it's not so much a calcium excess disease as it is that the animal protein, when you double your animal protein intake, your calcium excretion goes up by 50% in the urine. It forces an increased calcium loss in the urine. So that's what increases the environment for kidney stones mainly. You mentioned oxalates, and certain of the green leafy vegetables, especially spinach, are very high in oxalates. So people who do have a history of kidney stones or recurrent kidney stones should manage or moderate their intake of spinach. Other green leafy, so like kale, are no problem. And in general, though, the main root cause is animal protein.
So if someone were to have a history of kidney stones and not obviously want it to recur, because I've heard it's almost as painful as childbirth. So if that's the case, if they choose to continue to eat animal products, then they should be limiting the amount of spinach or almonds and those types of foods. But do you think that, or have you seen situations where people have given up animal products and have been able to consume regular moderate amounts of almonds and spinach and then not had a recurring problem?
I think that's a good point. If you're not eating the animal proteins, your risks are already much lower, and you can afford more oxalate-containing vegetables. And if you're still eating animal foods, then you do have to be even more careful. But I'd emphasize that the oxalates are a smaller component compared to the proteins. Mm-hmm. If you can't expect to say, well, I'm just going to eat chicken 3 times a week, and therefore I'll be able to eat more spinach. The less the better. If you really don't want to get kidney stones again, ditch the animal protein in all forms. That includes especially the higher protein ones, like egg whites, the chicken and fish that people commonly think of as healthy.
Just a small little break so that I could let you know that I know that you can get frustrated with your children when you want them to eat more plant-based, when you want them to eat the meals that you're putting on the table, when you know that they might not be getting all the nutrients that you want them to because they're choosing not to eat what you're putting down in front of them. I understand that frustration, and that is why we created the Putting an End to Picky Eaters program, where you have videos, spreadsheets, recipes, and more to help you learn the skills that you need to get your child to be eating more nutritious plant-based foods. So check it out at planttrainers.com/shop or in the show notes. Now back to the show.
Thank you. And I think that's a really important message for people to hear from all aspects if they have given up animal products since their diagnosis, to be able to say, okay, I can eat some more of those foods. However, if you could eat the kale and you could eat so many other leafy greens, you can live life completely healthy without having spinach. Yeah.
Absolutely, yes.
Can you explain to us a little bit about dialysis and the idea also of hydration? And a lot of people on dialysis will limit their water because their kidneys aren't functioning properly and it can cause problems, but hydration is so important. So help us understand how to properly navigate this situation.
Yeah. Again, let's back up a little step. As your kidney function, usually we measure it in what's called your eGFR, the glomerular filtration rate, and normal is over 60. As people start down a path of injuring their kidneys with inflammation, acid, mainly animal food diets, it drops down to chronic kidney disease at stage 30 to 60. That's called stage 3 CKD. Stage 4 ends up less than 30. And then when you start getting down to eGFR of between 10 and 15, you're getting in towards end-stage kidney disease. And if it drops down to that level for more than just transient, you end up with 3 choices. That's your kidneys are failing: dialysis, kidney transplant, or more. And none of the three are really very helpful. The immediate kind of stopgap measure for people in that situation is dialysis, which is an artificial kidney machine. It's where the blood is literally pumped out from the system into the machine, where it's filtered in an artificial way and then put back into the body. People commonly have to do this 3 or more times a week, or there's what's called peritoneal dialysis, where it goes into the space within the abdomen and then flushes back out. People spend several hours a week on these kidney machines, and they cannot do the job like your kidneys did. Again, it keeps people going, but 20% of all people on dialysis die each year. It's not an easy life, and it's not a great prognosis. So I want to emphasize the importance of preventing getting to that stage. Chronic kidney disease in its earliest stages may be reversible, but when you get to that stage, that's what you need. Now, for your question, if you're on dialysis, yes, you need to limit your fluid intake. You need to carefully watch potassium and phosphorus. You need to be under the care of a renal dietitian and a dialysis team that includes a nephrologist. And you need to follow carefully those things. You're right, the cravings for fluid become there, but since your kidneys can't take out the extra water if you drink it, you have to carefully monitor how much you're taking in. It's part of the process, just like people with certain diseases have to carefully monitor or give themselves injections. People on dialysis have to carefully follow a routine to keep themselves in balance.
So if you mentioned that you need to avoid foods that are high in potassium and phosphorus, I mean, I know bananas have been marketed as the potassium food when there's so many other foods that are higher in potassium, but that's a significant amount of plant foods. So you have somebody who's got kidney failure and they're told to avoid potassium and phosphorus, so they give up those foods and therefore eat more meat, which is then creating a bigger problem. Is that what we're seeing?
Absolutely. We used to say that, and still many folks believe that sense that you need to be so careful about those. But even people in stage 4 chronic kidney disease with some good planning should still eat plenty of fruits and vegetables. And let's talk about potassium first. And again, backing up a step, our kidneys are responsible for acid-base balance. And if you eat more foods that have an acid kind of ash to them, and this comes from the animal protein and the sulfur amino acids that are in those, cysteine and methionine. The highest of all is fish. Also pork and poultry are very high in these sulfur-containing amino acids. So this acid environment forces the kidneys and puts a strain on the kidneys to try to do their job. Instead, if you're on a plant-based diet, the alkaline environment helps your kidneys to function better, prevent decline, and better handle potassium. So your kidneys are more able to manage the potassium even in the later stages of chronic kidney disease if you're not eating the animal protein. So do you see what I mean? A lot of the dietitians still have people eating the meat, which creates the environment where the potassium goes up, and then, don't eat the potassium instead of getting to the root cause. It's a common misunderstanding. You do need to monitor, measure potassium, and in some cases moderate or limit those foods, but to eliminate them or switch to meat is counterproductive. In fact, potassium intake is correlated with longevity and a decreased incidence of chronic kidney disease. If you take general population, those with the highest potassium increase have a 44% lower risk of going on to chronic kidney disease. So people in general, and even those in stage 3 CKD, eat lots of potassium foods and cut out the animal foods to help that concern. Once you get to stage 4, work with a qualified renal dietitian to make sure you're monitoring it. And then let's talk about phosphorus. It turns out that the phosphorus in animal foods is much more easily absorbed than those from plant-based foods, which are in the form of phytates. Since we don't have the enzyme phytase to digest it, you may only have 30 to 40% of phosphorus absorbed from plant foods, whereas 60 to 80% from animal foods. In addition, they commonly inject animal foods as a preservative with phosphates, and the 300 to 500 milligrams per serving, and this further adds to it. So, and then, of course, phosphates in preserved foods and soda pops, even diet soda, are horrible. They're very quickly 100% absorbed. And so cutting out the fast food, junk foods, sodas, and animal foods actually helps for phosphate, too. In one study of people with late-stage chronic kidney disease 3 with an eGFR of 32, they did a crossover study, 2 weeks of vegetarian versus 2 weeks of regular diet, and those on the vegetarian diet had lower phosphate levels. So this whole myth that, you need to go back and eat more meat to prevent your phosphorus problem is a challenge. Once again, you get into late stages of 4 or 5, you do have to be more careful because the normal function of the kidneys isn't there. Work with a qualified renal dietitian to manage that. But yes, potassium, phosphorus are overblown, and again, commonly even by many in the medical profession, used as an excuse to get people away from the very diet, whole food, plant-based diet that would help prevent progression.
It almost feels like the conversation about having osteoporosis and you need to take in more dairy to get your calcium, when we've learned that the calcium is being withdrawn from the bones to be able to balance the pH level of the blood, so it puts it into a vicious circle. So it just reminded me of that situation.
Absolutely. Higher dairy correlates with higher osteoporosis.
Right.
I was in the grocery store the other day, and I mean, when we get feedback from people who have worked with us, for people who have, done coaching with us, or even just come to our lives, the feedback that we get is that we're extremely sensitive to where people are in their journeys, and that we don't, that we take them on their journey, where they're ready to go, when they're ready to go, and that they never feel judged by us. But I do find that walking into the grocery store lately, even more so than meat in the cart, because I understand why people don't know as much as they know. But the pop, the soda pop, the soft drinks that are in the carts, and these people their whole cart was filled with soda, and I'm like, please tell me that they're having some kind of party. I mean, I still wouldn't serve it at my party, but please tell me that they're having some kind of party. And I'm starting to get to the point where I can't hold back. The same way the things you think when you see someone smoking, we should know better. With the pop, we should know better. And I don't think that people understand the severity of what is happening to their body every time they take a sip.
Absolutely. Yeah, I know what you mean. You want to allow people to take their journey and make their progress as they do. And at the same time, especially when it's people you may know or care about, you see them doing things that you know is hard, and you have to kind of wait for them to ask, because the worst thing to do is to start a confrontation, which ends up to be counterproductive. So good for you for recognizing the importance of helping people when they're ready.
So we've been talking about chronic kidney disease, but how do people know if they have it? Are there certain signs or certain symptoms that people would have that would show them or their doctor that they have chronic kidney disease?
Wow, that's a big part of the challenge here. In the early stages, it's totally asymptomatic. You wouldn't know. You don't see it in your urine. You don't feel any different at first. In fact, some people come with late-stage kidney disease and their only symptom is fatigue. So the first thing is to recognize, as I mentioned, that the vast majority come along with other chronic disease, especially diabetes and hypertension. And if you have those conditions, you should follow with your physician, or hopefully you have a primary care physician who will intermittently measure your blood tests, and it's an easy blood test to tell if you're in the early stages of it. And the thing I would coach people to is that eGFR test is reported on common basic metabolic panels, and if your doctor doesn't start a conversation, if it starts getting down close to 60 or in the upper 50s, open it up. Because oftentimes doctors are so used to that just being common. When people get to be 60 years old, it just always goes into the 50s, so they don't even mention it. No, that's a teachable moment. As soon as it gets to 59, I sit people down and say, you now have chronic kidney disease stage 3. You don't want to end up on dialysis. And they're like, wait, what? I said, no, don't get me wrong. You're far from that. But if this continues, I've seen this. And one of my patients in particular went into the 50s and 40s, and I kept talking with him. Yeah, I'll get to it. Eventually got down to 30 and then 12. And I said, you got to head over and get on dialysis. He says, no, doc, I'll eat whatever you want. I said, what? It's too late. And so it's imminently preventable if you reach it in those early stages. In fact, in one study, they took type 1 diabetics who had you could see the rapid decline over the prior 2 years in their kidney function, put them on a plant-based diet, and it leveled out. Pretty much all of the 12 people, it's a small study, but 12 people in the study over the following 2 years leveled out their kidney function. So it's possible at most stages, in most situations, you never say always, to arrest this decline.
That's my question to you. You said it's too late, and you're saying arresting the decline. Does that mean that we can stop further deterioration, but we cannot reverse, and we cannot get better than 50 or 60 once we're at 50 or 60?
That's a good question. There's two parts to it. We now understand that diseases like diabetes, obesity, and hypertension are reversible. They're not really diseases at all. They're metabolic imbalance conditions caused by wrong food. When you give a human organism food it was never intended, metabolic imbalances happen. And if you start feeding right again, those can reverse. Chronic kidney disease, though, is more like chronic lung disease in smokers. After a while, those alveoli in the lungs start to break down and open out from years of abuse of smoking, and people get emphysema that's not reversible. The same thing here. Nephrons in the kidneys are resilient but not indestructible. And when you eat animal fat that clogs the arteries, animal protein that induces what's called hyperfiltration and makes the kidneys rev up 30 to 40% just to process that animal protein. Carnivores have kidneys that are 3 times their size per body weight than we do. They're designed for this. Our kidneys aren't designed for that. The pro-inflammatory components from heme iron and TMAO from arachidonic acid in animal foods put such a strain on the kidneys that those nephrons literally start to die out. Now, as some start to die, the blood flow is first shunted toward the other ones, and they can help pick up the slack for a while. But this process continues over and over, and as such, they're on a downward path. So, in general, we think of chronic kidney disease as arrestable through good diet, but not reversible. The exceptions to that would be a couple-fold. Is that acute kidney injury is reversible, and that can come from pre-renal, post-renal, that can come from a variety of causes, and that's a sudden drop in kidney function, which can come back, and sometimes people confuse that. Wow, I went way down in my kidney function, and I reversed it. That's acute kidney injury. Chronic kidney disease is a slow, gradual decline, and I have several times seen in the early stages reversal because people do change in time enough while those ones are still kind of resilient enough to not be fully damaged or lost. So I have commonly seen people go into the 50s, they change their diet, they reverse their diabetes, their hypertension, and it comes back up to the 60s or even 70s. So yes, in that case, in the early stages. And there are occasional times where people get down even lower and improve it with their kidney function. Because let's face it, getting rid of the root cause environment, it can do nothing but good for the kidneys. But I do think we have to be careful about giving people false hope and saying, hey, when it gets down to where they start to talk about dialysis, just do this and it'll go away. You've got to focus on prevention.
Unfortunately, people wait till it's too late to really make changes, and that's one of the things that we're all trying to do, is trying to get people to make change before they absolutely have to make the changes.
Yeah.
I work with a lot of women who have stress, anxiety, fatigue, maybe adrenal issues, maybe cortisol issues. And the adrenals are very closely knit to the kidneys, of course. And I think that doctors at least I feel like in the States, doctors do every test imaginable because they want to make sure that they're covered from all kinds of things that can happen. In Canada, they are much more cautious, and they need to have proof that they're doing a specific test and spending money on a specific test for good reason. So as people get older, of course people expect, oh, well, I'm 60 years old, I'm 70 years old, of course I have kidney failure or something like that. But should younger people who maybe have healthier lifestyles now but are still experiencing chronic fatigue issues get their kidney function tested and make sure that their doctor does that if it's not part of their regular labs?
They should. Yes, again, especially if they have high blood pressure or diabetes, but even in general, it's good. Again, you don't have to overdo it, and depending how you're feeling and partly what your lifestyle is. If you're whole food plant-based, probably every 5 years for a screening test is good enough if your results are good. But if people continue to choose to eat the standard American or standard Canadian diet, they should be more cautious and make sure that it is checked. That's a good point.
So for our listeners, our viewers, what can they do to ensure that they're keeping their kidneys at their healthiest point? Are there certain things that people should be focusing on?
Yes, several things. The number one is the diet. As I mentioned, it's not only the animal fat, which clogs the arteries heading to the kidneys and compromises them, and cholesterol, but the animal protein, which increases hyperfiltration, creates inflammation, is an acid kind of a kidney salt. They have to form ammonia in the process to help counter that, and over time that leads to kidney toxicity. And then other compounds called advanced glycation end products, which occur when meats are cooked at temperatures above 212. Grilling, baking, frying result in these advanced glycation end products and heterocyclic amines, which are toxic all over the body, but the kidneys being especially sensitive. So number one is move away from the animal and processed foods to a whole food plant-based lifestyle to best preserve kidney function. Number two is to limit or eliminate non-steroidal anti-inflammatory medicines, Motrin, Aleve, ibuprofen, aspirin, taken over a regular time. I'm not saying now and then if you get a backache and you need to take a Motrin, don't be afraid of that. But over time or higher doses can be especially hard on the kidneys. And, as Shoshana mentioned, drinking enough water. If you're eating high water-containing foods, you don't have to be as concerned about that, but stay hydrated, drink whenever thirsty, especially if you're working out, to make sure you stay hydrated. I used to tell my kids, when you get up in the morning, take a drink of water to give your kidneys something to work with, because overnight you're making urine, but you're not drinking, and you want to stay hydrated enough to give your kidneys something to work with. And then importantly, too, avoid those chronic diseases that put additional assault on your kidneys. Diabetes, hypertension, the two biggest ones, are almost entirely preventable and commonly reversible, even when you have them, through the same whole food plant-based lifestyle that helps prevent the kidneys. So yeah, it's really pretty straightforward, and it's pretty cool too that the same diet that helped prevent heart disease and prostate and breast cancer and Alzheimer's and gallstones and appendicitis and acne and all this also helps prevent chronic kidney disease. It's the same thing. You feed the organism right, and it does well by you. One other point, because you got me started, is fiber. Fiber is critical nutrient. 97% of Americans, and probably about as many Canadians, are fiber deficient in their diet. And the average Americans have like 15 grams a day, and that 97% is the 30-gram level, which is our minimum recommended amount. Even that is excessively low compared to what we really need. If you look at areas of the world where fiber intake is robust, you're talking 60 to 100 or more grams a day, which is really normal human that our ancestors evolved on. And this is critically important for your kidneys too, because that feeds your microbiome. I'm sure you've had other guests on talk about this, because it's all increasingly recognized as critically important. And if you feed them right with fruits, vegetables, whole grains, and beans, and the fiber residue that goes through to encourage diversity and healthy microbiome. They detoxify, they produce nutrients, they're anti-inflammatory, they help manage hormones, and all of these effects support kidney health. In contrast, if you feed them chicken and cheese and eggs and potato chips, Pop-Tarts, and ice cream, they don't do very well, and they do the opposite. They produce inflammation, they increase estrogen reabsorption, they create toxins, they create gap junctions in the colon and set us up for autoimmune disease. So we can't talk about kidney health without also talking about fiber. Everybody thinks of it as, hey, that supports your colon health and it might help other things, but it really helps every organ of the body, including the kidneys. So fiber in every bite.
Fiber in every bite. I love that. And yes, we have had so many guests on lately that fiber in your cantaloupe that have been talking about that. And it is true that whatever it is that we're trying to conquer in the body, it is the same nutritional prescription, more or less. So that is huge. We want to thank you so much for taking the time with us today to talk about kidney disease. It is so prevalent, but not usually talked about. So I think that this is a very important conversation that we had, very important conversation for the listeners and viewers to share, I should say. And if somebody would like to learn more about you or where you work, where would you like them to go?
Wow. I work in Ann Arbor, Michigan. I've been in family medicine, lifestyle family medicine for 35 years now. My practice is closed. I'm not looking for new business, to new patients. But you can go to our practice website, IHAcares.com. My group is getting more into lifestyle medicine. I just started as the first medical director for our Lifestyle Medicine Institute. So we'll be putting up more on our website about resources and information for our over 500,000 patients in Southeast Michigan, and others are welcome to look in on that too. Some of the other groups I'm involved with are even more focused on lifestyle and plant-based nutrition, and these come to that how-to question, because a lot of people get information for your podcast and they go, okay, I got it, but how? I'm not used to this. And two groups, one you mentioned already, PPOD, p-pod.org, is a great educational group that caters mostly to health professionals, dietitians, nurses, and physicians, with an annual conference. We just completed it last weekend, as you mentioned, and the next one coming in May will actually be a double conference, one in Raleigh in North Carolina, one here in Ypsilanti, Michigan, hopefully live if COVID allows it by then, but also a virtual option. So anybody from anywhere will be able to attend either of those. And again, top experts from around the country, many of whom you've interviewed, will be speaking at that PPOD conference. And so that's a great resource for learning and education. And then for everyday support, and especially for people in the community, Plant-Based Nutrition Support Group, pbnsg.org, founded by Paul Chatlin, who reversed his heart disease and went on to, we've got over 7,000 members now from around the world, and spreading to small groups around the country and Canada to help people with education, cooking classes, information sessions, now virtual talks. Every month we have a small groups virtual meeting. Usually I'm involved in that. We answer questions and assist people with practical advice, like what do I do when I go out to dinner? How do I go over to a friend's house to eat? What do I shop for? How do I make quinoa? All of these things that are important parts on the how-to. So those are three resources. If you like, I can send you my Dr. Bob's 8 Keys for Health and Success, which has a lot more resources. If you have a way of posting or sharing that with your group, I'm glad to share that with you. And it has a lot of other resources, including documentaries to watch, websites, books, and info that will help people to advance as far as they want or as far as they're ready for on this journey to health and vitality.
Dr. Breakey, it's amazing information. Thank you so much for sharing all of this with us and our listeners. We really appreciate your time and for joining us on the Plant Trainers Podcast.
Oh, thank you for all your work. You're doing a great job of helping people to see how you can improve your athletic performance, your overall health, your longevity. And I so appreciate having partners in this movement like you two. Thank you for having me today as well. And let me know if I can assist at any point in the future.
Thank you.
Thank you all so much for listening to this edition of the Plant Trainers Podcast. We want to make sure that you subscribe on iTunes, Google Play, iHeartRadio, Stitcher, or any other podcasting platform.
We really appreciate the feedback we receive from you. Every time we get a 5-star rating or review on iTunes from one of our fans, it really helps other people find us, just like you did.
Thanks so much to our patrons. To become a patron, visit us at patreon.com/planttrainers. Even supporting us with $1 really makes a difference in the quality of the show.
And don't forget to connect with us on Instagram and Twitter. Our handle is @PlantTrainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at planttrainers.com for awesome recipes, a list of our services, and of course, our latest podcast.
We encourage you to email your questions to info@planttrainers.com so that we can help you improve your quality of life through nutrition and fitness.
So we hope we've inspired you today. Join us again next time and have a healthy day. Or is that too corny?
It's a little cheesy.